Hey, I'm Erik.
I'm Nick.
And I'm Dalton. We're here at athletic training students here at St. Cloud State, and today we're going to talk about heart and lung auscultation. So for lungs, what you're going to do is you're going to start, if you had a stethoscope, you take the end of it, and you would start above the clavicle, listening on each side. Then you'd go down, and your first point is the second intercostal space. Take it there on the opposite side, and then progressively just move down, zigzagging each side, the third, fourth. Then progressively you're gonna start moving more laterally as you go down each side of the lung, listening until you get to that sixth intercostal space. And then on the back, what you're gonna do is you start above the clavicle, kind of like the opposite side, listen above, then you find your C7 landmark, your seventh cervical vertebrae, and that's where you're gonna listen, right in the intercostal space on the posterior side, and you're gonna do that down until the third thoracic vertebral spot. And from that point, you're gonna do the same thing, but on the opposite side, and start moving lateral on each side until you get to about the 10th thoracic vertebrae. Dalton?
Next, we'll be going over listening auscultation of the heart. First, you're going to start with right here, just to the right of the sternum is going to be your aorta, your aortic spot. And then when you go to the left, and left of the sternum, and a little bit lower than that aorta, and that's your pulmonic spot. And then right about in the middle is your Erb's point. And then below Erb's point, you're gonna have the tricuspid valve, you'll be able to hear there. And then you'll go even lower and to the left, moving laterally, and you'll get your mitral valve there. The heart sounds you should hear, a typical heart sound is gonna be a lub-dub sound. The first beat you hear is gonna be that lub, and that's the closing of the mitral and tricuspid valves. And the second beat, a dub, the dub in the lub-dub, is going to be the closing of the aortic and pulmonary valves.
And so the point of all of these auscultations is to identify any abnormalities. And auscultating the lungs, any abnormalities you might hear are bronchial, vesicular, stridor or crackles, and maybe even pleural rub or friction. And with heart auscultations, you might hear a heart murmur, and you can test that by having the patient lay down and then while listening to their heartbeat, and then have them sit up, and you might hear a whoosh sound, and that would be positive for a heart murmur.
All right.
Thanks for watching.
listening.